News 3 starts now with breaking news.
In a 222 to 209 vote just moments ago, a bill to fund the federal government through January 30th and end the longest government shutdown ever has passed in the House of Representatives. The bill mainly passed along party lines. However, there were some notable defectors. 6 Democrats broke with Minority Leader Hakeem Jeffries to reopen the government. The 2 Republicans who voted against the bill included Representatives Thomas Massey of Kentucky and Greg Steube of Florida. It is now off to the president's desk. He is expected to sign that bill in about 45 minutes from now. And if time allows, we're going to show it to you live on this program. Good evening. Thank you for joining us on this Wednesday. I'm Dana Wagner. A key sticking point left out of the deal is a guaranteed extension of the Affordable Care Act subsidies, which are set to expire at the end of this year. So as open enrollment continues, people here in Nevada say they are already seeing the consequences. We took to Facebook asking if your health insurance company has notified you about rising premiums. This viewer says she saw a more than 50% increase, with her rate going from $540 a month to $820 a month. Another says that her partner's rate shot up from just $36 to $300 a month starting next month. The uncertainty in the market leading to fluctuating rates and changes in coverage impacting Medicaid recipients and those who rely on ACA subsidies to reduce their premiums. Our Will Silverstein spoke with Medicaid recipients today and insurance brokers who help people relying on the ACA, and joins us live with their concerns about the cost and status of their health care. Will?
Well, Dana, these people that we spoke to are parents and grandparents. They're saying welcome to the club as far as these expensive insurance costs are going to cost, but they themselves are worried if they can even afford their insurance going forward.
Well, I'm a single grandmother raising my granddaughter, and if they increase the premiums, then I won't have money to pay rent after that.
Ronda Gauthier-Jordan was headed to the Nevada Division of Social Services office when News 3 asked her about her insurance.
And I'm extremely concerned about where that's headed.
Gauthier-Jordan takes care of her granddaughter full-time. She's worried that the costs of her insurance are on the rise as some Affordable Care Act subsidies are at risk of going away. She says her grandchild is in good health and she wants to keep it that way.
Everything I do is to make sure that she can, do what she needs to do.
I'm here today because all my program stuff has been dropped.
Gregory Brown experiencing a similar hardship. He says his insurance that he uses to take care of his family was recently dropped.
I have 2 special needs children at home, and I'm just trying to figure it out. And where do I go from here?
Here's one of Gregory's sons, Marcus, who is a talented young musician. Brown tells us he was born at 1 pound, and despite his wonderful talents in overcoming adversity, his health is still in jeopardy.
It's scary times. My son has had 13 surgeries, and he has another one coming up, and I can't afford it.
Now we see costs that are sometimes as high as 400% and 500% of what clients are currently paying.
That's insurance broker Brian Douglas from Protect Health. His team working the long shifts to help people scurrying to him with questions as the future and affordability of their care is in jeopardy. Douglas says the expiring credits hit hard for individuals making just above $60,000 a year who utilize the Affordable Care Act.
This year, the line cuts hard at 400%. Yeah. So some people who had a $200 tax credit because they were at 405% of the federal guideline, now they're getting no tax credit. So I've seen clients go from $200 a month to $2,000 a month in premiums.
Douglas' fellow managing member, Robert Morgan, seeing dramatic increases to cost of care as well.
A client of mine that I did a renewal on just a few days ago, currently paying $11 a month, will be going up to $175 per month.
Morgan suggesting people may be okay paying for the higher costs now, but if the economy worsens?
My biggest concern is going to be in the springtime, when people continue to pay these high premiums and might decide, why am I paying for this?
The debate over whether these subsidies continue rages on Capitol Hill. So what advice in the meantime do Brown and Gauthier-Jordan have for our viewers who may be in the same boat?
I hope everybody get the care and the things they need.
I mean, I don't really know what all we can do.
And Dana, I'm sure you've heard the quote before, hope for the best, expect the worst. That's what insurance providers have been doing. They've been prepared for the worst. These subsidies expire December 31st or so, but open enrollment still continues to go on for January 31st, through January 15th, which means you have that time in between to still be part of open enrollment even after those subsidies are set to expire, just a case of whether or not they do.
Well, that leads me to my question here, Will. What are those brokers recommending? Should you enroll in health insurance before the subsidies expire or after?
Well, they say you can enroll now. Basically, what they're trying to tell us is that the way that they expect this to go down is that those first 2 months you're going to be paying those higher rates that the providers have already started to put out for folks and that folks are already enrolling in at this moment. But if those subsidies are extended, what you're going to see is that the rest of the rates for the years, those will change because the state of Nevada will have to refile the rates. Then that means that people's costs, those premiums, will go down for the rest of the year, aside from those first 2 months. But something interesting to note, those subsidies may not look exactly as is. One of the reasons for that is that some Republicans are looking at things like abortions, if they're covered by certain healthcare, other women's reproductive health, as issues that may not stick, that currently would exist in the subsidy or could be potentially funded, that may not exist after if a deal is reached by the end of this year.
I'm glad you brought up that abortion issue, Will, and that dovetails perfectly into our next story here because the Republicans are bringing that up. Abortion issues may be at the center of this health insurance subsidy debate going forward. We spoke with Congresswoman Susie Lee, a Democrat who lives here in Las Vegas, about whether she would consider passing continuation of those health care subsidies without those health care protections.
Let's work on a negotiation to extend these, but that means I'm not going to roll back protections for reproductive care. I'm not going to roll back protections for kids up to the age of 26 to remain on their parents' health care. And I'm certainly going to be watching to make sure there's no rollbacks in protections for pre-existing conditions.
To watch our full interview with Congressmember Lee, you can head to our YouTube page at News 3 LV. And you heard those brokers talking about skyrocketing health insurance premiums. Here's what health insurance watchdog healthinsurance.org has compiled regarding increasing marketplace rates. Some providers like HMO Nevada and Silver Summit have rate increases of 19.5% or more. Traditionally affordable plans like Health Plan of Nevada are running 15% more expensive in this open enrollment period.